Hello everyone, today we will learn about the Psamomma bodies. So the first question is what are these bodies and why we are studying about them, okay? So these are basically round microscopic calcification which are present in the damaged tissues. Basically not present when the tissue is started getting damaged. So particular organs have this characteristic of forming the Psamomma bodies to direct to represent the pathology that something is wrong inside that particular organ's tissues. Okay, so this is the representation of the Psamomma bodies. You can see the lamellas around the a center, which is making it concentric appearance just like an onion. So we can also say that it is lamellated, concentric and onion like appearance. So wherever you are seeing these bodies, we can easily identify that these are the histological slide of Psamomma bodies. Here you can see uh, many Psamomma bodies together in a particular slide. So this is a more magnified image and this is a bit less magnified so that you can see several Psamomma bodies in a group. Okay, now we will answer the question where do we find these Psamomma bodies. So first thing what is clear that these are basically lamellated concentric onion like appearance, and these are basically the calcifications. Okay, why they form, they are formed to represent the pathology going on in the organ or in the tissues of that particular organ. Okay, so there are certain organs which are associated with the presence of Psamomma bodies, which includes the list here. Okay, we will discuss one by one. So first one is the pituitary gland. So in the pituitary gland we have the tumor called prolactinoma. If someone is having the prolactinoma tumor in the brain, in the pituitary gland, then the pathology and histological slide of the gland will represent the Psamomma bodies. Okay, similarly thyroid, in the papillary thyroid carcinoma, not all the type of carcinoma of thyroid mentioned to be here, that the specific papillary thyroid carcinoma of thyroid will represent with the Psamomma bodies. Along with that, we'll have to learn about CNS lining. So what happens here is if we are having melatonic schwannoma or meningioma, these two, both of them are associated with the Psamomma body's presence. Okay, then we come to the pancreas, the rare tumor of glucagonoma also represents Psamomma body. Along with that, a very important organ of human female, which is ovary. Any kind of tumor, whether it is benign or it is malignant, can show the presence of Psamomma bodies in the histological slides of ovaries. Along with that, we will learn about endometrium and cervix when it comes to Psamomma body, papillary serous carcinoma of endometrium or cervix, and cervical polyps. Along with that, endometriosis. So these three are also the cases in which we find the Psamomma bodies in the histological slide. So this is it for the video about the Psamomma body, guys.